Now, I would like to welcome here representative of the EU, Mr. Andrzej Rys, who is Director for Health System, Medical Products and Innovation at DG Sante in the European Commission. Mr. Rys unfortunately couldn't take part in our conference in person, but he has recorded his opening remarks. So I'd like to ask for the video. Thank you very much.
Report of 10 years of implementation of this directive. It's a pleasure to speak to you today. I'm so sorry I cannot be in Prague with you today. I planned my holidays earlier this week, but I am with this video with you. And many of you know how I am close to the patients. I am a patient myself as well, so I speak also somehow about issues I believe are important also for me as a patient. But let me also say a few words that how I am always appreciate, what's happened in Czech Republic during last years and how you reform your relations with patients, how you welcome patients in the policy making. And I think it's also great that you are now sharing this experience with other patients across Europe. When I reflect, all the years when I am in the European Commission, it's more than 16 years. Of course, the flagship initiatives in the area of patient rights and as I say, mother directive was a directive of patients' rights for cross-border healthcare. This directive, which we just assessed, a few weeks ago, we published a report of 10 years of implementation of this directive. It showed the directive is working. It was the cornerstone of the debate about the patient's rights for cross-border healthcare, but of course in much wider context. What this directive has done, it's kind of established the package of rights for patients for cross-border healthcare, but also help with the definitions and debate of the patient safety issues, quality of healthcare, national basket of services, access issues, but also with the communication with patients. National contact points really enlarge the scope of work and experience, how to communicate to patients and with patients. But this directive, as we have stated in the report, showed that also the cooperation of member states was strengthened in the areas like health technology assessment, in the area of digital health, but also in European referral networks. We built, huge system over 1,600 members across all member states, helping patients with rare diseases. So we should be proud, we as a patients, but also member states, European Commission, what we have done. But of course, more can be done, and this directive, as we concluded, has still room for improvement and development. This number of action points, which we could also for you have a look and tell us, is the right approach we are taking for next step. But now about patients' voice in European policy making. We patients, you are heard. We have the system of public consultation, and the patient's voice is heard. I can tell you, I have seen a number of great input from patients' organizations, individual patients as well, to when we debate health technology assessment proposal, when we are working on the pharmaceutical strategy for Europe and the new package of legislation in this sector, when we are reforming blood tissues and cell services, and just proposed a few weeks ago by the European Commission, when we develop, but first also debate a lot, the European health data space, very important piece of legislation, and the system which help us first establish a level of rights for us patients to have access to the medical records, to our data, but also how share this data in the benefit of society, research and development, policy making as well. And finally, important European initiatives for cancer patients. Europe beating cancer is an important policy area since a number of years, but in this Commission we really focus on this area, very much supported, of course, by European Parliament and Member States. And finally, a few words about the patient's engagement in the institutions. The best example would be the membership of patients in the management board of European medicine agencies. We have patients representatives, but also health professionals and others. And this is also showing that the patient also governing, the system of European medicine agencies in Europe. Patients are represented in a number of expert groups, for example, e-health stakeholders groups. Patients will participate in HTA implementations and so on. And of course, patients are in European reference networks. You are in a number of networks, all networks quite active, but also on national level in this field. And in conclusion, we also propose some financial resources. Patients are part of the EU for Health program. Patients are participating in a number of research projects. Patients are part of the beneficiary of the biggest public-private partnership innovative medicine initiatives, followed by innovative health initiatives. I hope it's also showing that the financial resources are helping engaging patients in the European projects and helping, of course, you work in member states. So I wish you a very good day, and thank you again for Czech presidency organizing this meeting.
Děkujeme panu Rysovi za jeho úvodní řeč.
Thank you, Mr. Rys, for the introduction. And now I'd like to welcome the representative of the Czech Ministry of Health, the Deputy Minister Jakub Dvořáček.
Dámy a pánové,
Ladies and gentlemen, good morning to you. As for my introduction, I prepared it in English, so should I speak in English or in Czech? Well, so part of my introduction will be in English.
The amazing people you were able to invite to the Prague, because I see a number of participants who I know for a long, long time. I see Karen Facey here, and I still remember the time. It's like 2014. You said 2014. It's difficult to remember. When I first, met with you, and I get the chance to read your work, to read your book about the patient involvement in the global decision making processes around the globe. And I have to say, it was one of my first recognition that we can achieve with patient something absolutely amazing. And it's a really long time ago, and it's here. It's here in the Czech Republic, it's materialized. We are in the stage that we have patients involved in small part, but involved in decision-making, not just evaluation, but also in the decision-making process. So Karen, first of all, before I will thanks to all other people, I have to recognize that, and thanks to you, because it was a big inspiration for all of us all the time, and it was a long, long path. I'm also happy, and I hope that I can see Nicola Bellington, not here yet. Online, okay, because I thought Nicola will be also here face to face, because she was here a few days ago in Senate. We get the chance with Dr. Kraus, the head of the Healthcare Committee of the Senate, to have a discussion there, which was moderated by Nicola. And EPF and all that structure which is around the EPF, it was a second inspiration for us here. And we started with discussion with EPF again many years ago. So those two ladies really involve us a lot in very positive way, and I'm also happy that both of you are involved, in this conference. I also have to thanks to all our national colleagues, especially the colleagues who are involved, in National Patient Association in NAPO. It's also quite an achievement. It's not always common that in every country you have a working umbrella covering the majority of the patient organizations. I know you are at the beginning, but it's a big achievement again. and it's putting the things together. I can see, it's like a puzzle which is now start to create the picture, which I believe, all of us will like it. Still, there is a lot of things which we still need to move it forward, and I don't want to say that the Czech Republic is a role model for the Europe, but after the 10 years of work, I believe we are very close to one of the best practices around the European Union. And I'm very proud to say, in that way. So all of you who are sitting here, all of you who are online and who support us, in this long process, long pathway. And I still remember the time, it was now more than 13 years ago when I started to work for Pharmaceutical Association. My first time when I went to the ministry and we started to discuss, some changes in the legislation. And that time I just discovered there is no patient involved. And it was quite a strange situation, to see, the discussion, how to let's say, develop the part of treatment without those, who are, let's say, the most important part. So the clients, the patients, and it was again one wow moment which I had, those years ago, and it was the first step and first push when we start to work together to prepare something, what will change the situation. Now we have in Czech Republic the special department and the ministry. We have a patient council to advise the minister. We have a NAPO, which is the covering umbrella, which is also a huge achievement. And we have a patient hub, again, the platform where the patients can meet and use the capacities, which are normally very difficult to get it. And all those things will be very important, especially now in the time when we see a big pressure on the public finances, not just in the Czech Republic, we can see it all around Europe. We had the whole yesterday in Prague, in Congress Center, was dedicated to the informal meeting of ministers, to the EPSCO meeting, informal EPSCO meeting. And when there was no member state of the European Union, which doesn't express, the difficulties they can see coming. And especially in the time, which will be, I would say, one of the biggest crises which we will probably face during our lives, we have to insist that this development we started years ago have to continue. And I'm very happy that the main topics or one of the key topics of the discussion today will be dedicated to the area of funding of patient organizations and their role in the system. And I can assure you that the Czech presidency will support you. It's a short time. We will only have, let's say, another 3-4 months to do it. But in all our discussions, I believe, and we will do the maximum, we will raise the topics of patient involvement in the European structures, in all important organizations, and Andreas mentioned it, European Medical Agency. I believe the patients needs to be always also included, in discussion of ECDC, or the discussion about the legislation, which is very complicated. The development of the legislation in the European Commission. So all those things is still in front of us. We need to work, on the definition of the patient organization, not just in national states, but also in the Europe. And based on that, I believe we will achieve, that those, who are, let's say, served, through the healthcare system around Europe, will have a right to say what is the best possible treatment, what they need, and what is their experience from the treatment and from the care which is provided by the systems. So all those things, will be very difficult to keep it in front of us during the time which will come. From financial perspective, but also from the political perspective, you see, how the media in the Europe look like now. From the COVID crisis, they just flew to the Ukrainian crisis, now to the economic crisis, energy crisis, and we will have a accumulation of those things together, and it will just fill the space, and everybody will focus, on those topics, and we have to keep, the smaller things. And I don't want to say that the patient involvement and the funding of patient organizations is small thing. But those things which will look like small things, during the time which is coming, we still need to keep it, in front of our eyes and to ensure that it will not just disappear because there will be other important issues and topics. And especially the funding, it will be very difficult to achieve it, especially when all those national systems will be under big pressure, and it's something what is inevitable. There will be a big pressure, and it will be not just the Czech Republic; it will be all European states. That's just reality. And we have to just prepare for that and work with this information. And I believe, based on that, we can jointly manage it. So what I would like to also mention because the most of the day will be probably dedicated to this discussion, how to make the balance between the way how the patient organizations are funded and then their rights to be included and involved, in all those discussions and creations of policies and also the approval of the new technologies. We had this discussion a few days ago here locally, how to fund in the future the patient organizations in the Czech Republic, and I believe the key issues are based on the development. If you have a patient organizations who are only serving to the patients, there is probably no big issue, with the funding. I mean, if it is from the healthcare area, it's the role of the payers. If it is a social area, it's the role of the Ministry of Social Welfare, and the money. And it's just on the agreement how the money is supposed to flow. When we coming to the role of the patient organization, which is above the basic services to patients who are, let's say, from the therapeutic area, when we start to talk about the advocacy, when we start to talk about the patients involved in evaluation and decision making, about the reimbursement, then we are touching the area which is much more complicated. And we have to just find a way how to ensure that there is enough funding for patient organizations, but there is also no conflict of interest, which can create a difficult situation through the media, but also through the discussion between the stakeholders. And this is the situation which we are solving now here in the Czech Republic. We need to find a way how to ensure that there will be not just the money coming from the industry to the patient organization, there are not just the money coming from public collections or the fundraising activities of patient organizations or private donors, but how to ensure that there will be sufficient funding for patient organizations to create their independency and also the chance to create this space, to be involved in evaluation and decision making. We passed the first pharmaceutical product through this new pathway where patients are involved. In the Czech Republic, we're starting with orphan designated product. So the patients are part of the evaluation, the patient organization who is involved in the therapy, and then we have a patient representative as a part of the committee who is recommending the reimbursement to the minister and to the State Department of Drug Control. And in this case, it's the very fragile structure, and if we will not find a good way of funding to ensure this independency, it could be, of course, questioned from number of other stakeholders, like from the payer side or from the side of medical scientific societies or the media. So this is in front of us, and we already announced that the Ministry of Health create the committee and invite the representative of other ministries to sit together, also with payers and with other key stakeholders, and find a way how to create the funding, the scheme, which will allow the independency of patient organizations in that field, to allow also the extension of this practice to other areas of the new therapies, not just to the orphan designated products. So as I said, we have a first. I believe it's not the last. It's number of them now in the pipeline. So we will see and we will learn based on what's happening in that committee. We will try to really create the good methodology for the future. We have one, but of course it will be still adopted based on the feedback and experience from those meetings. It's also important to mention it that we need to support and continue the support in the training of patient organizations in the HTA. We need to ensure that the patients are at the same level, like, for example, representative of medical scientific societies. And I believe that even in this small group sitting in this hall, we will find the number of patient representatives who are now in that level of understanding of health technology assessment, which is absolutely comparable to the people from the medical scientific societies who are participating at that committee. It's a 4 years work. Every year it was more than 20 people who passed through that training. And this is, again, something what we just should not forget it, and we have to continue to train the patient groups, even in the moment it is just, for the orphan designated products, because for the future, it's something, what will be the important value for further extension, of this model. So let me conclude, at the end of my speech, that we are quite far here. We are happy to share with all other European countries who will be interested, and I know there is already some countries who get this best practice from Czech Republic, and it's coming out. The next step, and it's also the part of the Czech presidency discussion, is to ensure, that this is happening also on the European level. I know that the patient groups are involved, in the work of EMA and also the EUNETA. So this is happening, but I think they have quite similar problems as we have here locally. We have to say, what is a real patient representative organization? And who are, let's say, the one who should sit there, who should be invited, not as a guest, but as a permanent partner of that discussion. So there's still a lot of work which needs to be done on the European level, and I believe, that those umbrellas like National Association here, jointly with EPF and other institutions, can do it. And all those steps have our full support, from side of the Czech Ministry of Health and from the Czech presidency. So I'm happy that you did this event, and I will not take more of my time because I think it was 10 minutes and I'm close to the time limit. Yes. Okay. Perfect. So once again, thank you for the invitation, and I should do it at the beginning, but I will do it at the end. I will apologize our minister. It's not that he don't want to be here. It's just, that the current agenda is so full, and I finished it yesterday at 8 o'clock in the evening, but he finished it around 10 o'clock in the evening. So just please understand, that in this moment, when we have the Czech presidency in the full scale, it's a bit complicated to be everywhere. But the greetings from his side, and once again, have a good time, and I'm looking forward to see the outputs of today's meeting.
Děkuji panu náměstkovi za úvodní.
I would like to thank the Deputy Minister for the introductory speech, and really you are on time. Thank you very much. And now I'd like to welcome or open the conference, in fact, and to welcome the person who will be chairing the debate, Karen Facey. And I think she has been introduced, but Karen is not only an expert as for interventions in healthcare systems, she also works in academia, and she also promotes patient involvement in the decision-making processes. She knows Czech Republic. She has been here repeatedly, participated in trainings of patients, and I think many of you know Karen in person. I'm very happy that she is going to really moderate this meeting, to host this meeting. Karen.
Thank you very much for that. What I presume was warm introduction, because the battery on my translation ran out. It's always the problem with technology. So if any of you need to go and get another set, please do get up. I'm just going to swap mine now. The challenge with technology. It is an absolute pleasure to be with you this morning and to join those who are online. As Jakub said, he invited me in 2014 to come to the medical faculty to talk about health technology assessment. And within that session, I mentioned patient involvement, and the Industry Association immediately picked that up and thought, actually, that's something important. We can work on that here in the Czech Republic, and very much working in collaboration among the Industry Association, the patient organizations, the medical faculty, and very importantly, the ministry. working together, we will see today what has developed in terms of patient involvement. And it's really very impressive. And it shows something that's really important in patient involvement to understand, and that is that patient involvement is a journey. We can always continue to develop the way in which we engage patients meaningfully. We need to perhaps try some new systems, develop new systems. They take a long time. But then we need to implement, see how patients become engaged, understand whether their feedback makes a difference. If not, are they appropriately equipped to engage in decision-making? How do we engage them better? And continue to evolve our processes as we would in any healthcare decision-making process, that process of quality improvement. But I would like to turn now, because you've had quite a bit of talking already, to actually try out that Menti thing. So let's give that a try. And we'd like to ensure today that we involve you. We want to hear your opinion. For those online, they can be chatting and asking questions. But for you in the room as well, and for online, can you please log in to Menti with your phones or your devices? Because I will be asking you a question, because I would like to know who my audience is. That's the first step of involvement, is to understand your audience and their objectives. So we've got a question for Menti, which is not shown here. So I'm not quite sure how, there we are. We have to switch systems, but if you go into Menti now, you should see your first question, which is asking you where you're from. Always a good question to ask. And we can see here that the counts are coming in quite quickly. So you're obviously a high-tech audience, because everybody's logged in and we can see 24 responses already. I know we've got about 40 online and we've got about 80 in the room, so we'll give this some time to come in to see what's happening. And not surprisingly, the largest number at the moment is patient organizations and industry, a couple of academics, consultancy, 3 from the ministry. I'm going to give you all more time. I can see fingers clicking. And for those of you in the room, just a reminder that there is a free Wi-Fi network if you need it through the Prague network. And speakers, you are allowed to join in as well if you would like to. I think we've got 38 at the moment, so still majority of patient organizations. Oh, it's good to see ministry representation, 5 from the ministry here. 2 regulators and HTA, 3 academics, 1 consultancy. We're up to 47. I'm going to give you another minute or so. And while you're just giving those reflections there, I'm just going to maybe make some reflections on what Jakub said there, because I think it sets us up very well for the day, and what Andre said. So Andre, reflecting on cross-border healthcare, how long that's been in place, and how that has led to a range of policy initiatives. If we think now, whether it's HTA, which is the field I'm interested in, health technology assessment, but we can see developments in digital health, in real-world data with the European health data space, an area that's very important to patients, but also in particular disease areas like the Beating Cancer Plan, the European reference networks for rare diseases. These are all really important policy areas, some of which I would say involve patients a little bit, not so much, but perhaps particularly in areas like the European reference networks for rare disease, there is more that could be done. And we could be reflecting on that. And Jakub there also talking about the challenging times we face. We have to have today's conference in a discussion of reality, which says there are many challenging things that all of our governments have to deal with at the moment. Funding being an issue, and make sure that the issue of patient involvement is not lost among the many challenges we have, whether it be war or environmental crises, and put that into the context of health system sustainability. When we have a big problem, we need everyone to work together to the solution, and that's what we want to do. So we seem to be coming to some stability on our Menti, and we've got 30 patient organizations, 17 people from industry, 5 from ministry, 2 from regulatory HTA bodies, 3 academics, and 1 consultancy. So that gives us a feel for the balance in the room, and everyone is most welcome. Everyone's voice is important, so please do speak up and join in when we have the question sessions. That's given you your kind of test of Menti, and I think we can take the Menti slides down now. We'll swap systems, and we'll go on to our next presentation. As Jakub said, a key supporter of the development of patient involvement in Czechia has been Nicola Bedlington. Nicola Bedlington will be known to many of you who are in patient organizations. From 2006, she led the European Patients Forum until 2019, and she's now set up her own small consultancy to develop patient involvement across the whole of health service delivery and policy development. And she's unable to be with us today, but she has been helping us in the development of this meeting and has been able to record this presentation for us. So I'm going to turn now to Nicola's presentation. And what we want to do with her presentation is I want you to think about it. We can't ask her questions because she's actually traveling at the moment, but we will be pulling in some of her thoughts throughout the day. So what is it that we need to do to ensure more effective involvement of patient organizations in health service delivery, decision-making, and policy-making? Over to the video, please.
Thank you so much, Karen, for that very kind introduction. I'm delighted and honoured to be presenting this keynote address on patient involvement in health policy making, the vital ingredient. I'd like to look today at the added value of patient making has evolved in recent years, patient involvement in national policy across the European Union, to give a little bit of a snapshot, what matters most to patients and some challenges that they're confronted with when it comes to policy making, moving from tokenism to empowerment and what's been achieved over the years, and then looking forward, patient involvement as we are grappling with an increasingly complex world. Let's look first of all then at the added value of patient organisations. Back in 2017, the European Patient Forum commissioned a report that makes visible the invisible added value, roles and activities of patient organisations. And through a comprehensive survey with the membership, it was clear that patient organisations are invaluable partners both at European and at national level, in therapeutic research and development, in public health research, service co-design and evaluation, capacity building, and policy and advocacy. It's also clear that peer support is also a core function. Mentoring, counselling services, legal and financial support, self-management education, and of course, providing that link with wider patient communities. It became clear in the research also that healthcare organisations could actually be better at signposting patients to relevant patient organisations and communities for support and input. Let's home in then specifically on policy and advocacy. The added value of patient organisations is really to provide that end user perspective to help policymakers really understand more profoundly the experience of living with a disease or condition and the implications for legislation and policy making. It's clear that patient organisations are active at all stages of policy development and in a range of institutional settings, working across a range of not only health but also social policies. And essentially, they contribute to a more nuanced, balanced policy making that's really based on fairness and equity, with the outcomes and goals of patients at the forefront. There have been a number of developments in recent years with regard to the patient's increasing role, spearheaded by flagship projects like EPATI, the European Patient Academy on Therapeutic Innovation, and Paradigm, which was another IMI project that focused very much on patient engagement in the life cycle of medicines and how to make that easier for everyone. We see in clinical research that patients have moved from being passive research subjects to reviewers, sometimes co-researchers, and in some patient organisations, the driving force behind the research. We see with HTA agencies and committees some progress. It's not perfect yet, but there has been some progress in recent years, and it will be interesting to see how the recent legislation at European level on HTA supports this potentially. And I know, Karen, this is something that you've been absolutely passionate about over many years. With regard to research and ethics committees, it's a little more patchy. Patients are involved in some research ethics committees in certain countries, but it's not yet systematic as we wanted it to be when we were discussing the clinical trials regulation. It's clear another positive role that patients play is actually shifting public perception, building trust and confidence in research more generally. In the space of the regulatory environment, competent authorities, we see the sterling work of the European Medicines Agency, really a model in patient involvement. And then looking at policy making, there has really been a huge amount of influence over the last few years. We see, in fact, that hard legislation has been significantly influenced directives and regulation at European level. Legislation like the Cross-Border Healthcare Directive, the Pharmacovigilance Directive, Medical Devices Directive, and also soft policy, so the conclusions, the recommendations, the guidance, the outcomes of joint projects have become much more patient-centred. We've managed to introduce amendments through the European Patients Forum and our member organisations in very many European dioceses to make them much more patient-friendly, to make the actual legislation much more workable for the benefit of patients. We've also undertaken significant campaign work through the European Parliament election campaigns, developing our own manifestos and what the patient's position was in relation to what the Parliament should be doing for patients, but also significant year-long campaigns in the areas of patient empowerment and universal health coverage in the framework of the Sustainable Development Goals. There's been substantive involvement in the European Medicines Agency, as I mentioned, a model of involvement, and patients are involved at all levels in the management group with a voting right, in a dedicated patient and consumer working party, in the context of very many committees, for example, the Pharmacovigilance Risk Assessment Committee, the PACT, but also many other scientific advisory committees. So a really strong model for others to follow. And patients have also been convening key meetings involving policymakers, decision makers, and other stakeholders to sit around the table and look at solutions. This has resulted in a cultural shift amongst policymakers and other stakeholders on the importance and the impact of the patient's voice. So just looking a little more closely at an example, the clinical trial regulation. As this regulation went through its legislative journey, the European Patients Forum and its members were very keen on introducing a much stronger wording in relation to user-friendly, patient-friendly, informed consent. We were also very keen to ensure that transparency was there front and centre, and we were keen to see the results of clinical trials being made public, even those that fail, because one learns so much from these. And patient involvement in ethics committees, we pushed for that, and unfortunately we were not successful. We were, however, successful in the context of informed consent and indeed transparency. We did that in collaboration with others, a platform called All Trials, which is a very effective multi-stakeholder platform showing the value of collaboration. And we're still doing ongoing work in the context of layperson summaries within the European Patients Forum, making sure the guidance is right for the layperson summaries to be as effective as possible. When it comes to exchange of experience, know-how, leapfrogging, so one member state learning quickly from another member state where there's a really good example of good practice, and soft policy, we see this happening in a multitude of areas: patient safety, quality of care, equitable access, health technology assessment, digital health and responsible health data sharing, and of course in the arena of patient empowerment. Looking at national level, again, there are some excellent examples of really good patient involvement in policy across the board. Health in Italy, a very strong process of public consultation in Portugal, regional health conferences in France, making sure that policy making isn't only happening in Paris, really effective approaches to engaging patient involvement in HTA in the UK. But it's interesting that there is no, let's say, mapping exercise, comprehensive mapping exercise to get a really comprehensive overview of what's happening in every single country. So that's maybe a gap that needs to be addressed in the future. There has been some recent interesting research in Central and Eastern Europe in the context of patient organisation, industry collaboration, but it led to some interesting wider findings. Core funding and diversity of funding remains a really critical issue for patient organisations in the region. There's a need for skills and capacity building, particularly among smaller organisations. And the capacity building programme that's been developed in the Czech Republic is seen as, let's say, a leader. The Czech model has really been incredibly impactful, as you will know from colleagues around the table today. The critical success, buy-in from the government, a credible academic partner, ownership and unity among the patient groups, leading to the creation of NAPO, of course, and sustained smart financial support from industry. The importance of ensuring a good relationship with industry was highlighted, based on core principles around transparency and independence. And there are strong examples throughout Central and Eastern Europe of patient engagement in regulatory settings, in HTA and pricing discussions, with a seat at the table. Yet this is not happening systematically across the region, unfortunately. It's still on a very piecemeal basis. So what matters most to patients at collective level through their representative patient organisations and online communities? Meaningful patient involvement in health systems, service design and innovation that will ultimately influence their access, their experience of care and the outcomes that matter to them. A recognition of their unique experiential knowledge and expertise. Being valued as an equal partner with a legitimate and important contribution. And appropriately and fair resourcing to play this crucial role. We need to move from tokenism to empowerment, and we're very much on that journey. And we're really looking at 3 levels of engagement: at direct care level, and that quintessential relationship between patients and their trusted healthcare professionals and shared decision making. In the healthcare setting, organizational design, governance, service strengthening, and in the policy-making setting where policy and legislation is decided. And we're looking at a continuum of engagement from consultation to meaningful patient involvement to ultimately partnership and shared leadership. There are some challenges out there, and that was revealed in the research in Central and Eastern Europe and also the research work that EPF did in 2017 in the context of the report I mentioned at the beginning of the presentation. One thing to stress is the importance of solidarity, community, and identity to avoid this competition between different disease groups and disease ranking. My disease is worse than your disease, because that just creates a divide and rule setting that helps nobody. The lack of and unpredictability of resources and funding is also key, and the lack of unrestricted funding for organisations to really run their operations. Questions around the credibility and alleged lack of independence of patient organisations because of their relationship with industry is sometimes a problem. Professionalisation and versus representativeness, and finding that balance between having a professional organisation but making sure that it is really authentic and reflecting the views and needs of the community. The emergence of new online communities that need to be managed, and I'll talk about that in a moment. Overcoming sometimes a culture of tokenism or cronyism, where the same individuals are always chosen to do a particular task and there's little opportunity for newcomers. And a lack of performance measurement, or rather lack of knowledge on how to measure the impact of patient organisations. There are also some drivers, leadership, of course, having a strategic anticipatory approach, alliances with the broader health stakeholder community, and there are many examples of that now. Integrity of all partners, and these are not beautiful words, not only beautiful words, but actually fundamental to getting things done. A robust advocacy plan, clarity of purpose, strategic thinking and preparation, evidence-based advocacy with the end goal in mind, knowing our audience very well, accessible slogans and sound bites, a strong and united patient's voice, 150 million reasons to act, and collaboration between online patient communities and traditional patient organisations, really optimising the policy impact through digitalisation, social media and smart use of data. I believe that online communities and traditional patient organisations can do more than coexist, but really collaborate deeply together. And bearing in mind that once successful in changing a policy or a law, that's when the work really starts. So looking forward, patient involvement in an increasingly complex world. The role and responsibility of patient organisations, one could argue, has never been greater. And EU and global studies have revealed how patient organisations really stepped up during COVID-19 to deliver for their communities, to protect their communities. So important. There was a recognition, there is a recognition that health systems need investment and person-centred reform. We now have a new European Health Union and a large-scale, well-funded European Union health programme alongside quite a significant research programme as well through Horizon for Health. Health is seen to be central to recovery and resilience mechanisms and the funding that is being awarded to the member states to get back on track. It's a fast tracking of digital transformation and certain regulatory processes due to COVID. And this has meant a repositioning of the role of patient organisations. They are an essential ingredient in building back better, more responsive, person-centred, value-based health systems. So just to conclude, some personal learnings. Knowing our audience is crucial. Identify who is a key target and researching this thoroughly. Who are the champions around that person? Who are their adversaries? We need substantive, credible, scientific and anecdotal evidence. Economic arguments alongside the human factor and human stories is a very powerful blend. Making sure that our members acknowledge and understand our agreement in changing a law or policy. So, for example, if a law is agreed, directive, regulation is agreed at European level, it's really important that members at national level understand the implications of that and to work effectively with government and other stakeholders in ensuring appropriate implementation. Living with the outcome of a legislative process, the perfect can be the enemy of the good, and there is a bit of good in every piece of legislation, one could argue. And patients being at the centre, the natural convener to bring different stakeholders together for solution-oriented discussions. But patient organisations should not become institutionalised or in any way comfortable, but really powerful change agents with the agency that they need to move forward and advance the interests of their really important communities. So I'd like to thank you all very much for your attention, and I wish you all the very best for your important meeting today, and give the floor back to you, Karen. Thank you once again.
Thanks. I know Nicola's not in the room, but let's give her a round of applause because I think that was a great presentation. I could see a number of you taking photos of that last slide, and we will put all the slides available on our website because I think that those wise words of Nicola were excellent for us to think about during the day, about how we develop credible patient organisations to get involved in patient organisations. She, as did Jakob, touched on funding, and I think that will be an element for discussion today. But I want to make sure I'm involving you, so let's ask the next Menti question. So get your phones out. And I want to know, as Nicholas said, it's always important to understand your audience. What is your expectation coming here today? But I'm going to give you a challenge. Say this in one word. I can see this as a challenge because you're all thinking about it. That's good. And you can write this in English or Czech, because Robert's going to help me with the Czech. So we can see networking, connection, inspiration, patient involvement, progress, meet international peers, a vision for development, knowledge, understanding, change. That's good. I like change. Networking, new inputs, finding vision. Robert, what are some of the Czech words saying?
Ta česká slova odpovídají těm anglickým.
The Czech words actually correspond to the English ones. Education, politician's ear. This is what has grabbed my attention. Knowledge, experience, sharing, inspiration, networking, connecting, sharing.
I think that what we all love, for those of us in the room, we're loving the having a coffee bit, which we apologise that those online can't be involved in, but do share the chat. So we're all here to be inspired by one another, and we do that by involving ourselves in the conversation, by listening to what others have to say, and hopefully we can have some of those light bulb moments as we leave today. So we're actually going to move on to the next section of our programme. And Nicola reflected on how patients have developed their involvement over a range of areas. And she first of all mentioned clinical trials, regulation, and HTA. And we're going to be thinking about that in our next session. She also mentioned best practice examples. And that's what we're going to be looking at after lunch with some of our colleagues from other patient organisations around the world. So this session we're calling Involvement of Patient Organisations in the Life Cycle of Medicines Development and Approval. And we're going to have hopefully 3 presentations. First of all, from the European level, you will know that Nicola mentioned there the good work of the European Medicines Agency, and they've been developing their patient involvement over about the last 15 years. And we're going to hear from Maria Mavris about that. And we will then have two presentations from here in the Czech Republic. We are waiting for our colleague from the State Institute for Drug Control to arrive, so we may have to swap the presentations around. We're going to be quite flexible, but we'll see what happens. So what we will do with this session is have 3 presentations and then 4 discussants, and then we'll be moving to you for questions. So jot down any questions you want, and we'll have about 25 minutes for discussion with you after we've heard the reflections from the panelists. So without further ado, I'm happy now to move on to Maria Mavris, and she is in the Public and Stakeholder Engagement Department at the European Medicines Agency, and she's going to join us today online. Welcome, Maria.
Thank you very much, Karen. I'll share my slides.
That's perfect, Maria. We can see the
Great.
Slides and you. Thank you.
Thank you very much. Good morning, everyone. And I really wish you a very good meeting. I'm sorry I can't be there in person, but it's really a pleasure and a privilege to speak to you today about some of the work of the European Medicines Agency. So I'll just go here to explain to you very broadly what the European Medicines Agency does. And this is the same as any other medicines agency, which is really to facilitate the development and access to medicines. At EMA, I'll refer to it as EMA, we regulate medicines for both human and animals. So that's important to keep in mind. We evaluate applications for marketing authorization, and we monitor the safety of medicines across the life cycle. So this is also once they've been put on the market as well. We make sure that the medicines are safe, and then we look at them if they're not. We also provide reliable information on human and veterinary medicines to patients and also healthcare professionals. Sorry, just having a bit of trouble with the slides. Okay, so the European Medicines Agency was created in 1995, and along with it came what's called the centralized procedure. So there are certain medicines that need to come to us, to EMA, and you can find the list of these medicines online, or the list of the diseases that need to be addressed online, such as cancer, HIV, rare diseases, neurodegenerative diseases, for example. And the benefit of the centralized authorization or centralized procedure is that all medicines that pass through this procedure are authorized at the same time in all of the 27 EU member states. We have a centralized safety monitoring, and the product information becomes available in all EU languages at the same time. The registration or authorization by national procedures does, of course, still exist, but there are certain medicines, as I've said, that have to come to EMA. But we do have access to all of the experts within these national competent authorities or national medicines agencies, which is very important because that means the voice of the different member states is represented at EMA as well. So to go specifically now to our long journey of interactions with patients and consumers, really this started from the very beginning when our doors opened, and we started dialogue with patients in 1996. And here I've just shown you some of the key milestones, such as when patients became members of a committee for the first time in 2000. This was with the Orphan or the Rare Disease Committee. Then we formalized our interactions with patients and their organizations via a framework, and I've put the document on the side in the image there for you to have a look at. We created a working party, which I'll tell you a bit more about. We have a dedicated department for working with patients, but also healthcare professionals as well. We have public hearings where we really open the doors and discuss with the public around safety issues. And of course, with COVID, we've had to also adapt and expand our engagement methodology by involving patients in crisis management, by involving them in what's called an emergency task force. And this is still ongoing and will continue. So looking now specifically at the medicine regulatory life cycle. So this is just a schematic that shows you all of the different activities that happen. In the light blue arrow, you see the 3 phases, what we call pre-submission, evaluation, and post-authorization. Underneath them, you see the activities associated within those different phases. And then below that, you see the names of the committees that are associated. And at the bottom, you can see the acronyms are explained because, of course, like a lot of agencies, we work with a lot of acronyms. Above the light blue line, you can see some of the graphics showing that there's documents, and these documents are produced for the public. And then all along, you can see the little image that shows where patients are involved. And you can see that this is really all through the life cycle of the regulatory life cycle of a medicine. And I'll tell you a bit more about that in the next few slides. So firstly, who does EMA work with? Working with organizations, patient organizations, is a very important part of what we do. So we work with many organizations, but we do have a group of what we call our eligible organizations who fulfill certain criteria. The criteria are available on the website, but I can also very happy to share any details in a post mail. So you can see in the table I have on the left-hand side, organizations have to fulfill these eligibility criteria, which are really about transparency, on representation, on mission, on funding. And then we also work with individual experts. That's the next part of the table, where we talk about the importance of the declaration of interest or conflicts of interest. So we have around 39 eligible patient organizations, and we work very closely with them. At EMA, we really look at representation of patients and their organizations within EMA at three kind of levels. We've described this in three ways. So this has already been mentioned a couple of times, which is very nice to see that this is also very important for us. We have patients as members of the EMA Management Board. There are two patients there, and actually a patient representative from EPF, Marco Greco, has been nominated for a second time, and also a patient representative from the European Organization for Rare Diseases, Virginie Hiver. So then we have in our 7 scientific committees, and you remember the acronyms are on one of the previous slides. So if you get the slides, you will be able to see. But the first patients were named onto the Rare Disease Committee. This was then followed by patients on the Pediatric Committee or Medicines for Children, the Advanced Therapies Committee, and the last committee to be created was the Safety Committee or the Pharmacovigilance Risk Assessment, where we have patients as full members. They have voting rights, and this is the same with the members in the management board. So these people have decision-making input into these very high-level important committees and boards. The next level, which I think is of interest for you, is where patients are representing their organizations. And how do they do this? So also earlier, someone mentioned the Patients and Consumers Working Party, which is a platform of 22 members, and these are made up or selected from amongst our eligible organizations, making sure we have representation of all of those mandatory diseases that I described, rare diseases, cancers, HIV, neurodegenerative. And so you can see the list of who these people are, or the organizations that make up the working party on the website. This is a very key working party. We also have a parallel healthcare professional working party, as it was mentioned earlier. Working between healthcare professionals and patients is very important, and there's a lot of cross-learning here. But patients representing their organizations do so in the working party, in EMA consultations, and in workshops. And ordinarily, when I give this talk, I would have said to you that organizations are not involved in disease-specific discussions or medicine-specific discussions, but we recently completed a pilot where we were consulting in very early dialogue patient organizations at the time when a company submits a marketing authorization application. So you can see here the medicines regulatory life cycle again. I've taken this middle phase of evaluation and I've blown it up to show you the days and how the kind of key milestones of the days. And we started consulting patients on day 1 at the time that the marketing authorization application was submitted. And here you can see that we've started the pilot, as often is the case, with medicines for rare diseases. And patient organizations were contacted early and asked to share key aspects about the perspectives of living with the condition and its treatment. This information was gathered and given to the co-rapporteurs who were assessing that particular dossier. They would look at the information and see if there was anything that could benefit being included in the assessment report. And then as it was a pilot, we would send a questionnaire to the rapporteurs and ask for the added value. And so given as the pilot was very successful, they found that there was 41% of patient input that was included in the assessment report, which was very good. Then we've decided that this is just another methodology that we will now incorporate into our toolbox of methodologies for involvement of patients. So just to complete the third level, as I've said, we have patients representing all European patients. We have patients representing their organizations. And so we also have patients representing themselves. And here we have in really medicine-specific activities where they have to complete a declaration of interest. This is in activities such as scientific advice, which is very early in the regulatory process, scientific advisory groups, which is at the time of the evaluation. Committees might want specific patients, in addition to the patients who are members of the committees. They might want disease-specific patients to come and have consultations. And of course, patients review documents that are destined for the public. If you are interested in registering your interest to work with EMA to represent your disease area, there is a button here, but this is also available on our website, and I'm more than happy to provide the link to anyone who might be interested. So finally, as we've also heard, working with patients is really, there are, of course, challenges. There's challenges on both sides. So from our side, finding the right people. Obviously, EMA, as I'm speaking to you in English, also works in English. So the language is an issue. We have 24 languages in Europe, and so we need to make sure that we can find people or support them in that. We need for people to understand where in the regulatory process all of these activities fall. And so that we have a training around regulation, and Nicola also mentioned EUPATI and projects, initiatives such as that. So understanding what the regulatory process is in the whole process of drug development. And then also making sure that patients understand what their role is within these activities. I've mentioned this a couple of times because it's very important, managing conflicts of interest. But then it was also mentioned how representative is involving 1 to 2 patients in a particular procedure. So this is an issue that comes up for us. And then measuring the value or the added value and the impact of patients is also something that is also raised frequently. So just to conclude, that for EMA, engaging with patients and their organizations really brings the everyday aspects of living with the disease into scientific discussions. We can have all of the scientific and medical experts there, but unless we bring someone who can talk to us about the day-to-day aspect, what it's like to take your child to school, what it's like to wake up in the morning, how hard it is to get dressed. All of these issues are very important, and they bridge the gap between clinical trial data and real-world data. By having patients come to our committees, being involved in discussions, reading the same documents, seeing presentations like this, we increase transparency, awareness, understanding of the process, and building trust. It's really been a stepwise approach across the 27 years of the existence of the agency. We've learned from patient organizations, they've learned from us, we've helped to define roles, and hopefully to ensure that engagement is a mutually beneficial process. So with that, I end my presentation. Thank you. I hope I'm within the time. And you have my email address there. If you do have any questions that might arise later, don't hesitate to contact me. Thank you.
Thank you so much, Maria. Great presentation from Maria there, showing the 25 years of development of reflecting on how to involve patient organizations, patient experts at different levels in different ways. And I think these are the nuances of patient involvement which we need to think about. It's not just a one-size-fits-all. We need to think about what the challenge is and how that can be best resolved in collaboration. And it's now my pleasure to welcome Irina Starova, who is Chief Executive of the State Institute for Drug Control. She's incredibly busy, and we are so honored to have you with us, Irina, because I am so excited. I think the last time I was in Prague is probably 3 years ago. I was in the Deputy Minister's office, and we were talking about the wording of the orphan drug regulation and what should be in there. We were talking about what was happening internationally, and it's just amazing to see this now being enacted in Czechia. So I want to hear all about it, Irina, to hear all about the orphan drug and the way in which patients are involved. Do come to the floor.
Okay, thank you very much, Karin. Dobré dopoledne, milé dámy, vážení pánové.
Good morning, ladies and gentlemen. So now I'll speak in Czech so that the other part of the audience will relax. Thank you for the invitation. This is a very turbulent day for me, and I'm happy I could hear part of the presentation of the EMA colleague, because today, let me say, we are starting a new series of negotiations of SUKO, the State Institute for Drug Safety, within the Czech presidency. This morning we welcome the representatives of all medical agencies. So you could see a survey that Maria showed, all the expert committees and working parties. The experts will come to Prague in autumn until December and will be negotiating. There'll be in 2 weeks another meeting with the directors of all the agencies, the director of EMA, representatives of the various committees. So we'll have a busy autumn, and I'm happy we could meet. So I have a very pleasant task today, and for the State Institute, I should sum up our collaboration with POs in the Czech Republic, how they are involved, and what has happened in the recent period. So, collaboration with POs is very important, and we see it as essential. There are many POs that we have signed a memorandum with, and I see many of you quite frequently. We discuss various topics. We know that the patient's role is important, the decision-making not only of SUKO, but other institutions has an impact on patients. So continually we have been trying that everything we try to tell the patients, and not just laypersons, even experts, we want to make it really easy to understand in our bureaucratic language. So let me start with the topic which I think is really the most debated one in the last 5 years, and that is the agenda of reimbursements and maximum prices. We have realized this is a very complicated agenda, and also for those who are not so knowledgeable about all the processes or specialized terminology and so on. So we try to make it really, really understandable for patients. At the beginning of 2020, we started publishing summaries for evaluation reports, and some of you may confirm it. Before getting to this point, together with you and expert societies, we heard their comments. We also had personal communications before COVID. So together with the evaluating reports, materials that were complicated, and sometimes a report had several hundred pages, which was really tough for everyone. And we started to publish brief summaries in various proceedings that were selected regarding new drugs, new substances, and so on. So if you wanted to see the documentation, you need the electronic signature, and we thought this could restrict the access of experts and the broad public. So from the 1st of September 2020, these summaries are published on the website of SICL without restrictions. And I think you all know how to get to these materials. So you can see the link here. And it took some time before we explained to each other, this is not the outcomes of the proceedings. This is just information about the administrative proceedings, what we got from the participants, and what we have summed up. So this is the information. This is what we have read, we have discovered. And if you know about other facts, please do get in touch. So I think we now have a common language. And if there are some other ideas that you have, please send them to us. We'll be very happy. This is not something that would be really set in stone. So here again, some more information. You get to our website, information about administrative proceedings, and there you can look up the summaries which you are interested in. This is a specific example. It's very brief. So you can see, apart from the broad public, 4 questions, basic questions, which in fact can be interesting for you. So this is one specific example. And now let me carry on. Of course, we did some other things as well, but we don't have time today, so I'll just mention the milestones. At the beginning of this year, there was the amendment 48, and one of the many changes was a new type of administrative proceedings for rare diseases medication. There had been quite a big discussion of all the stakeholders, and this is a material that was really expected quite eagerly. And now here it is. That's the abbreviation LPVO. And patients with rare diseases did not have a chance, according to standard legislation, to meet the criteria, the terms. That's why this new type was established, and I have all the legal sections there. So what is also necessary is that in these rare diseases and drugs, it is not the SUCA, State Institute, that determines it, but there is an applicant who asks for registration, or health insurance companies can apply. Then we evaluate the application, the legal terms must be met, and we can launch the proceedings. I have left out the timetable, the various deadlines, what SUCL will do, the advisory body of the ministry, new participants, how they can enter, that is POs and expert societies, in addition to the standard stakeholders. So what are the evaluated criteria that we deal with, the blue ones, but the red ones are the new ones. So to sum it up, it's a view. Well, last week we spoke about social health borderline. These are some of the soft issues we want to include, and they are important for the quality of life. So these are the criteria, as I have summed them up right now. This is the recommended structure, how participants can also make statements. It should be in a structured form. We have reduced some other calls for co-activity so that the rules are clear, what should be done, so that we can ideally process on the facts. Now, because of time, I can see how many minutes are left. That's why I'm speaking so fast. I'll leave the reimbursement, the prices, and I'll go to the do the area of clinical evaluations. As you know, there have also been transformations based on the relevant legislation and regulations, and these are adapted or have been transposed to the local legislation. So even here, patients become participants in clinical evaluations, and in fact it's also partly a task of ethics committee. We have this ethics committee, we have representatives from the ranks of patients. So let me show this. There's the first part, the protocol, and there is this handbook for the investigators, pharmaceutical documentation, and then the second national part. And in the evaluation by the ethics committee, participants, laypersons are involved, also within the guidelines of the good clinical practice. And this is what these persons are engaged in: information about patients, whether the consent is really easy to understand, information sufficient, and everyone or each patient involved must do this on a voluntary basis. And the patient, of course, has some duties, responsibility, and naturally the patient should be aware of all the risks, not just benefits of the treatment. Here are the rules. It also concerns medical devices and also of course, the instructions how to use. Sometimes you could read in the how to use a leaflet some information that was not easy to understand. So in fact, we should not be blind to some of the needs, but you as patients are confronted with this information. So on a light note, as I said, not only are we in touch throughout the year, COVID has stopped this for some time, and every year we try to hold a meeting at the State Institute, meeting with representatives of the POs. We always ask you which topics you care about, and we also involve our colleagues, and there is usually a discussion we always look forward to. So we are going to continue, I can promise that. Thank you for the invitation, and I hope the conference will be pleasant. Enjoy it. Thank you.
Huge thanks to Irina for that run through there, ending there with important engagement of patients in all aspects of clinical trial, particularly in developing informed consent. But for those who are reading the Czech, I'll pull out some important points there, that there's a requirement that patients must be involved before the clinical trial application comes in. So if you're saying you're involving patients, you have to prove that, and they have to show that they're being involved in the development of materials for informed consent. And in that new legislation, the important elements there that are new for the orphan medicinal products were that there's an evaluation of the overall social importance of the possibility of therapeutic modification and the impact of the treatment on patients, and a probable benefit on improving patients' quality of life, and the actual possibility of ensuring successful and effective treatment within the healthcare system. And I think that our next speaker may pick up a little bit on those elements, but I just thought I'd draw those out because they're really interesting development within this context here in Czechia. And so I will now hand over to our next speaker, who is Kateřina Slaba, who is lead of the Department for Promotion of Patient Rights here in the Czech Ministry of Health, which is a new department which was set up about 3 or 4 years ago. And I have to say, I think it's quite unique. Not many other ministries have such a department. We don't have one in Scotland, and I'm campaigning for one. So I'm really delighted to welcome Kateřina to the stage.
Krásné dopoledne.
A very good morning to you. My name is Kateřina Slaba, and head of the Department of Patients' Rights Support at the Ministry of Health of the Czech Republic. In my short presentation, I will speak about the development at the Ministry of Health in involving patient organizations in regulating medicinal products and HTA. I will also touch upon the definition of patient organizations. In healthcare, there are many stakeholders. It is the state, it is the providers of health services, health insurance companies, scientific societies, and patients themselves, for sure. A number of years ago, at the Ministry of Health, the theme started to be addressed that patients, even though they are the main recipient, beneficiary and users of healthcare, do not have their full voice in the system that would be listened to. In 2015, at the Ministry of Health, the agenda of involving patient organizations started to be established. And then in 2017, our Department of Patients' Rights Support was established. The vision and aim of our department is to make sure that patients and patient organizations have sufficient space within the system, that the voice of patients is listened to, that patients know about the possibilities of being involved, and that they would be able to use these possibilities. The main activities of our department include the following. We seek the space, the space at the round table, so to speak, where patients could be present and voice their experience. We also strive to make sure that patients are being listened to. And then third, and this is something that we've been dedicating our attention to a lot lately, is that we strive to create conditions to make sure that patients use this opportunity and know how to use this opportunity. For that sake, we use the patient hub. We educate patient organizations there to make sure that they are equal partners to other stakeholders. As the Deputy Minister Jakub Dvořáček mentioned, our aim is to ensure that patient organizations have systemic funding so that they indeed have all they need to be able to get involved in all these activities. We decided to involve patients in regulating medicinal products. We didn't want to reinvent the wheel, so that's why we looked abroad to see how patients are involved in these regulatory aspects. Patient is an irreplaceable source of information. We believe only the patient himself or herself has the authentic experience and convey to us what life with the disease or condition is like. In order to be able to involve patients and patient organizations in these regulatory issues, we've had to define who the actor is. So that's why we've decided to have a statutory definition of a patient organization. So first we involved Patient Council, which is an advisory body of the Ministry of Health that has been in place for a number of years. Already for the purposes of the Patient Council, we had to have a definition of patient organization. So the first definition was established back then. We tested it, and we also sought some inspiration from abroad. We drew inspiration from EMA, from EPF, and other examples from abroad. We debated everything with the patient segment several times. It was debated with the Patient Council. We had public meetings involving patient organizations and the general public to have a say. And subsequently, the Chamber of Deputies of the Parliament of the Czech Republic, the ministerial proposal was slightly amended. Patient organization is defined in legislation in the Healthcare Services Act. The first criterion is representation, so that to make sure that basically the organization is run, managed by patients, and so that patients have a majority share in that management. However, we didn't want to eliminate, for instance, pediatric patients or other entities who cannot. So those that are, for instance, the relatives of these people can take part. Then it's the mission, and that is to help patients protect their rights and interests, and also transparency of funding is another criterion. So, for instance, sources of funding have to be made public together with the financial statements that have to be made available online. Then legal personality, legal form, so it can be, for instance, an association or the form of OPS, beneficial society, or other. Then the activities and the existence has to be for at least 12 months. The organization that fulfills all the criteria that submits an application to the Ministry of Health is published on the list of patient organizations. So currently we have 30 patient organizations. They are published at the ministry's website. Organizations that are on the list of POs may take part in the assessment or in the they may be involved in the administrative procedure regarding orphans. So at the State Institute for Drug Control, PO is actually involved. Basically, the main factor there is to actually involve those patients who live with the condition, so they provide their perspective, their experience in that administrative procedure. Then the assessment and the administrative procedure is followed by the decision-making procedure. So there is an advisory body, the members of the advisory body, and with regard to preventing conflict of interest, patient organizations that were involved in the first phase can't be involved in this second phase. We strive to educate patient organizations to be able to be fully involved in this procedure, to be an equal partner to other stakeholders. We strive to also achieve systemic funding of patient organizations so that they would be independent entities and would have viable funding. We'll continue to dedicate our attention to this and hope that this will be helpful to patient organizations. Thank you very much for your attention.
To Katarina for that. And it's interesting there that we've got an example where the definition of a patient organization has been put into legislation. Again, Nicola talked about best practices. It would be interesting to do a kind of EU survey of whether that's been done in other countries and how that's been done, because I know that Robert and colleagues from other patient organizations have been really involved in that discussion about what is a patient organization, and it's not an easy question to answer. But I'd like us to move now to some reflections on those three really interesting presentations. So one from the European level, very much about medicines regulation, and then from SUKOL, looking at how patients are involved in terms of summaries, clinical trials, guidelines, a whole range of activities, including HTA, and Katarina's there, telling us about the detail of how the patient supports department is trying to support that. So I'm going to invite all the speakers and panelists to come to these big presidential chairs here that we've got in the Mayor's Building. So I'm going to first invite Anna Arlanazova, apologies for my pronunciation. Anna is chair of CAVO, which is a Czech umbrella organization for rare diseases, and she is a member of NAPO. Next is Jan Kust, who is director of the Department of Support and Organization of Healthcare of VZP, which is the largest public health insurance company here in Czechia. Then David Kolash, who is CEO of AIFP, who is the Association of Pharmaceutical Companies here in Czech Republic. Online, we have Maggie Galbraith from Haute Autorité de Santé, who is leading the patient involvement work for the European network in HTA. And could I invite Katarina and Irina to join us up here, because I want you to be part of this discussion as well. So do take a seat when you're ready. So I'm going to, what we've heard now is some perspectives from the regulator, from the ministry, from SUKOL, and I'm going to turn first to Anna. You've been involved in some of these developments. What are your reflections on what you've heard from both the European perspective and the Czech perspective?
Thank you, Karen. I have to first state that, as you have said, that patient involvement really is a journey, and for us in the Czech Republic, it really has been. It has been, to be more exact, a great learning process, and I think it's a coincidence of time, great people who try to push things forward, and of course, good luck. And so we came in right at the right time. We managed to communicate with the right people, and wonderfully so, this is where we are, and I'm very honored to be used as a Czech model, not only during we always have Czech supermodels, but this is a Czech model, totally from a different area, which I'm very proud of. And so I have to say, from the EMA, we know that EMA has been one of the first agencies to actually involve patients in the decision-making process, to been interested to listen to what it is to live with a disease of a certain kind and what is the everyday life as we have talked about. So I think all the member countries should be following the lead because it's important to create legislation that is effective for those, as I always say, on the battlefield, who have to deal with a disease on an everyday basis. I am going to peek into the history a little bit in terms of the creation and preparation of our legislation for orphan drugs, because it has been a real patient advocacy, I have to say. We have been doing it, I hope, the right way, because we involved not only patients, but also experts, but also members of the parliament, senators, the representatives of these institutions helped us approve this legislation, which, as Irena has said, has not only been about orphan drugs, but after a while, because of the patient advocacy, it has become the legislation on orphan drugs. But there were other very important changes that were proposed in there. But due to the patient advocacy, it was sort of more visible to all the parliament representatives of senators who actually said, okay, well, this is it. We need to talk to you about this. What can we do about it? So I humbly say that without the patient advocacy, we may not have had the approval. The approval happened last September. And ever since then, we have been preparing with the effect on January 1st. We have been anxiously awaiting the first applications. The first one is actually already passed. It's approved. It's a drug for SMA, and we're very, very proud of it. And there is 8 others that are following. I am also proud to say that for all these applications, patients' views, the patient statement has been admitted or will be admitted, because we do have patient organizations that will be able to file the statement. So I think it's wonderful. It's wonderful to see that we actually do have, even for the ultra-rare diseases that do not have any patient organizations, CHAVO, the Rare Diseases Czech Republic, is actually trying to provide the patient organization for those to actually file the statement. Everything based on very transparent and open ground. So, as Curious George always says, that's a little movie for children, I remain curious as to how it will go. And I'm wishing all of us that we have more and more early access to orphan drugs, and we're hoping to continue to empower the patients more, because orphan drugs is only one involvement and in the decision-making process. But we do hope in NAPO that in the future we will have the involvement not only in orphans but also in normal medicinal classic medicinal products. So that's my wish for the future.
Thank you very much for that, Anna. So I think that's really inspiring to hear how patient organizations have been involved in the drafting of the legislation. This is so, so important. But then to see this being enacted with the first orphan medicinal product coming through for a challenging area sometimes with spinal muscular atrophy, and 8 more in place, all of them going to have patient input. I think that's great news, and big congratulations for your involvement in that, but more still to be done, and we'll talk about the more still to be done later. But Jan, I'm going to turn to you now. You're coming from a very different situation, representing the sort of largest public health insurance. You've probably got some of those challenges that Jakub was talking about this morning to face. How do you see patient involvement, and have you learned anything from the speakers this morning?
Děkuji moc za slovo. Já bych s vaším svolením.
Thank you very much. I don't want interpreters to translate my English into English, perhaps, so I'll speak in Czech. I have, of course, written some notes, and then I decided to throw them away because I would only repeat what you have heard from the experienced speakers. But there is one thing in these notes. Health insurance companies must learn to speak in a different language. Because minimally, the legislation has always forced us, well, let me put it this way. We have the insured persons, and then there is even a smaller quantity, and that is patient. And we must have a fair approach to all the insured persons. Sometimes it's a problem to choose a group of patients we communicate with, and also the way of communication. But the European Union has played an important role because healthcare now crosses borders, and we know that the patient has his or her right. They may come to us, have the care reimbursed, and then the Czech legislation that concerns insurance companies has stated that patient comes in the first place. As for patient organizations, everything has been summed up excellently, and I really envy POs, one thing, and another thing that I don't envy them. So what I do envy is the capacity of POs, because they are the only entity which actively works on its non-existence, because the goal of a patient organization should be that there are no patients with a specific disease. Either they will be cured or they wouldn't really need the services of a patient organization. So, of course, insurance companies share this wish. The best insured client is that who is not ill at all. So this is where we have, I think, common interests. On the other hand, what I don't envy them, I'll explain it. My wife is wheelchair-ridden, and the pavement is a great obstacle. When you go from the roadside to the pavement, or when you go down, there is this step. So, or when you want to go to a car, you get in. So I realized that this is a huge problem. While for other persons, it's what helps them. So the capacity of the POs, and it again depends on their base. Those who are associated in the POs, they know obstacles can be overcome. Many of them have, in fact, contradictory problems that they want to solve. But also what we need is empathy. And sometimes empathy is lacking, and we cannot show it. Patient organizations know that, but we need empathy, otherwise nothing of this would work. In fact, I was involved in the legislative process originally. So I think POs should be involved in the legislative process, and it could then be made more comprehensible for everyone. If POs and other institutions and organizations are involved, it would be very helpful for legislation, because in the procedures we would not hear, no, this is impossible. everyone would have the right to say, this is what I think should work. That should be at the beginning of every draft. That doesn't mean that everyone will be happy, but we'll get into a situation when the legislative process will lead to stability, and the participation of the POs is very important in that respect. And then another change that has not been mentioned doesn't concern POs, but patients as insured clients. So everyone has mentioned some of the aspects.
Bring that point back later in discussion, because that's a really interesting issue around some countries calling them consumers because of this issue of being insurance. But you've raised really important points there about communication, about understanding what it's like to live with a disease. And that's been something that's been a common thread here. The value, the unique value of understanding patients' experience to shape legislation, policy, and the way we deliver health services. And you mentioned there people with disabilities, and that's a really important element. So thank you. I'm going to come back to you, but I do want to move on to David. What are the industry views, given what you've heard this morning?
Thank you. Is it working? Yeah, great. Okay, so first of all, thank you for inviting me to this conference. I'm happy to be here and happy to share with you the view and perspective of the pharmaceutical industry. So I'm really happy that current status quo and the development which was here for more than 10 years is perceived as the best example or one of the best examples for other European countries, and that we are always speaking for last 2 or 3 years about the Czech example. We as an industry, we got quite a history of working with the patient organizations. For us, it's not, let's say, last 3 or 4 years. We are working together for the decades. And I believe that also this relationship and the cooperation is developing quite prospectively, because from point of view, in the beginning it was mainly about the projects, about the awareness campaigns, about the common education and these kind of topics. Nowadays, patients are sitting quite frequently in advisory boards of the pharmaceutical industries. They are helping us to, let's say, get the treatment to the market, because it is important to also, let's say, hear from their side, from your side, what is your perspective, what is your feeling, what is your opinion and experience. And I believe that for the pharmaceutical companies, it's important to also learn from your side, your experience, your view on the topics which we are covering. I think that it's important to say that we are having a nice and great involvement of the patient organizations in the processes, also the decisive processes, but we are still in the beginning because, as it was stated numerous times, it's currently only for the orphan drugs. I believe that this pathway will probably look that is effective and works. And after that, we can think and discuss how to make it broader, maybe in the future for all of the medicinal products. And it's necessary to say also that from my perspective, but I believe that it's the perspective of the Czech Republic, patient organizations are currently the strong partner in the healthcare. It was not like this 10 years before, I think. But currently, they are participating almost in all of the discussions, meaning the legislative process, as it was stated. They are sitting in numerous advisory bodies on the Ministry of Health, even in payer side. And I believe that they are really considered as qualitative body which is necessary to take into discussion. So this is probably the point of view from pharmaceutical industry. Thank you.
That's great, David. So saying there that industry is involving patients on advisory boards, etc., and that's quite a change, because there have been concerns about conflicts of interest and how we manage those. And I'm going to turn now to Maggie, who we can all see on the screen. Maggie, it's great to see you. So Maggie is from the French Health Technology Assessment Agency, and she's leading the patient involvement work at the European Network for HTA. Maggie, you've heard the EMA presentation. You've heard the presentations here from the Czech Republic. Can you tell us a bit about UNETA and sort of what's been happening there and what you reflect on today's remarks?
Sure. So I hope that you can hear me okay.
Yes, we can.
So yes, I work at HAS, but I am primarily working on UNETA as part of the group working on how we are going to deal with patient involvement, especially right now going forward. So just to begin with, a little bit about UNETA. UNETA began in 2016 as an EU-funded project to create effective and sustainable network for health technology assessments across Europe. And UNETA has continued since then throughout the years through different forms, but it is originating in this current UNETA 21 consortium, which is running from September 2021 through September of next year. The consortium consists of 12 countries, and it is building on the achievements and lessons learned over the past about 15 years, with the ultimate aim being to support the future HTA system under the European HTA regulation, which came into force in January of this year and which will be applicable as of January 2025. And I'd also like to point out quickly that the Czech State Institute for Drug Control is a member of the UNETA Executive Board now. This consortium will produce guidelines and templates for conducting joint collaborative assessments, referred to often as JCA. So basically, these are HTA reports that are drafted collaboratively by the consortium members and then are published on the website and are used later on in the member states for reimbursement. The group also does joint scientific consultations, referred to as JSC, and also known in the past as scientific advice or early dialogues. And these also include the involvement of patients, and it's for both medicines and medical devices. So more specifically of interest to this group, I think, is the guideline and the accompanying templates for the involvement of stakeholders and experts that is currently under development. And I should clarify here that when I refer to stakeholders, I'm referring to the input of organizations. So like, I don't know that these exist, but for example, a Czech Diabetes Association or the French Melanoma Patients Association. And when we refer to experts, we are speaking on a more individual level, although yes, an expert may be a member of a patient organization. As well, the guideline is not yet finalized. It just came back from public consultation. So what I am presenting may differ slightly in the end, but hopefully not too much. So the aim of the guideline is to explain the recruitment and role of stakeholders, both patient organizations, for example, on the one hand, and individual patients and clinical experts on the other hand, during the production of JST and JCA, the process for collecting stakeholder and expert input, documentation of this input in the final reports of these two types of outputs, and the evaluation process for the involvement, so afterwards. And UNETA has for a long time now placed a priority on involving patients in our work and has strived to provide many different ways for them to be involved. I know we've done in the past focus groups, different questionnaires, open calls, participation of experts. Currently, patients can take part in joint scientific consultations either on a national level or at the EU level. The particularity about these JSC is that they're completely confidential. So unlike a JCA where the final report is publicly available, because of the confidentiality, this is not possible. And for this reason, since we are not able to divulge the specificities of the JSC without a confidentiality agreement signed, we are not currently involving stakeholder organizations at this time. Nevertheless, there are opportunities to participate as national level experts, or when an expert is knowledgeable of the standard of care and the burden of the disease, for example, across multiple European countries. They may participate as a European expert, and a European expert would then participate in the JSC procedure with the HTA bodies and can provide their feedback in a more continuous manner. They have access to the development dossier and would be requested to comment on specific things that are inside of it. And they also would then participate in the discussion meeting with the HTA bodies, the EMA, and the company. Patients can also take part in the 3 key phases of a joint clinical assessment, or a JCA. First, in the scoping process through online questionnaires for stakeholder organizations, and at the national level in helping them to define the different aspects of the assessment PICO. So that would be the population, the indication, the comparator, and the outcome. And also at the EU level to support the development of the consolidated PICOs, because the goal is to present the company at the end with these PICOs that are representative across Europe so that they can be reused. During the EU assessment phase, they can also be involved as an expert throughout the procedure. And finally, during the national assessment or appraisal phase, according to whatever the national procedure in place may be. So I'm going to stop speaking now so that we can move on to the discussion. I'm happy to respond to further questions. And since I'm not present and I don't have a presentation, I can write my contact information in the chat and it can be passed on that way. Thank you.
Thank you very much, Maggie, and certainly sharing your contact information would be helpful. So I think you've explained really clearly there that the new HTA regulation will be important for everyone in the EU, comes into force January 2025. SUKL is involved. But you've got 2 different ways in which you involve patients here, and it's dependent on really, for one matter, the confidentiality issue. So this is a challenge, but it's where you involve individual patients, and individual patients are then expected to sign confidentiality agreements, etc., and have very clear process ways in which we're involved. Whereas when we get to the joint clinical assessment phase, which will then go back to the member states, the patient organisation as a stakeholder can submit information, can be involved in the scoping through the so-called PICO process. And I think that's actually an interesting issue to reflect on, that at different points we need different things, and Maria highlighted that as well from EMA. And so I'm going to move now. I'm going to maybe ask Irina if she'd like to join us in case there are any questions. And we've got Maria online. So we've got 7 great speakers. Let's open the floor. Does anybody have a question? We've got 2 people with mics. And if you ask a question, we would be grateful if you could say your name, your organisation, and what country you're from. And we'll take 1 question from the room and then 1 from the audience. Or if the room are a bit shy, Jakob, is there any question online you'd like to give us?
Online máme několik otázek. První otázka.
We have several questions. The first one is for SUKL, State Organization. Eligible patient organization. Does SUKL use this terminology, or is it any patient organization that is involved?
Tak samozřejmě my v podstatě v rámci České republiky. Tak.
Sorry, you shouldn't have to touch them.
Tak, je to v pořádku? Děkuji. Tak.
I hope you can hear me now. Good. In the Czech Republic, even before the amendment to the Public Health Insurance Act, even without a statutory definition of the administrative procedure, we we're actually accepting inputs from patient organizations. So for us, the information was crucial, not the aspects of the patient organization. So now we have the statutory definition of the patient organization. Perhaps the Ministry of Health should make a statement about that, but we actually work with it in accordance with Czech legislation. Thank you very much. And there is another question online to Mrs. Slaba. You have mentioned the patient hub in your presentation. Can you please specify a bit more how it works? The patient hub is a physical space in Prague, in Vršovice, in Prague, that makes it possible for patient organizations to go there, work in these premises, hold their respective events there. Patient Hub also organizes education events, e-learning events for both the patient organizations and the general public. At the website of the Patient Hub, there is also a repository of all the e-learning and other education events that have been held to date. So you can find that information there. So it's a space that provides education opportunities.
The key things we identify is we need to build capacity. So I think that's a wonderful example we should share. The discussion's now hotting up. We've got 2 questions in the room. So I'll go to Derek first, and then there's a lady in the middle, if we can take the microphone too.
Thanks, Karen. My name is Derek Mitchell. I'm from Ireland, and I'm representing the Irish Platform for Patients, Science and Industry, and I'll be up later on. But my question, well, first of all, a comment that it is truly amazing to be in the room today. But it is truly, I think, amazing to hear about how, certainly from the public side and the ministry and the State Agency for Drug Safety, is changing the way that it works, and it's becoming much more patient-centered in its approach, and that's on the public side. And my question is to David on the industry side, that having seen the examples coming from the state agencies and the public side, is there an appetite from the likes of the associations, but also the individual companies, to change the way that they're working? We hear a lot about patient centricity as a mantra, but in reality, it's often difficult, I think, for individual companies. But I think there's a role for the associations to play in leadership in this. Is there an appetite there at the Czech level?
Thank you for the question. It's quite hard to answer there, because from perspective of the association, I believe that we are, let's say, in front of the, let's say, public sector, because we started already in 2012. We established the Academy for the patient organizations. We started to create a platform and the space for, let's say, joint discussions, sharing best practices and the education possibilities. But from the perspective of the individual companies, as far as the importance and the role of the patient organization is increasing, and they are part of the decision-making processes, there is the strict, say, push for their independency, meaning the financing, meaning the strict rules for the communication, how we can cooperate. And I can see it, for example, in our self-regulatory code of practice, which is in every state, I believe, in Ireland as well. Because in the last code of practice, the cooperation with the patient organization was just in the basic and general rules, and it was more not rules, but principles. Currently, the rules are settled on the same level of the strictness as it is for the healthcare professionals. And it was never, ever like this in the history. This is also, I believe, the reason why it is necessary to currently, for example, in the Czech Republic, discuss how to ensure the core funding for the patient organizations, because the rules for the projects and cooperation on them is probably the same like it was in the past. But it is not possible to let's say, cooperate or to support patient organizations from this perspective. And it's important, of course, for them to have this core funding. So I believe that the trend is to make it more stricter, the rules. But as an association, we are still developing and continuing in all of the activities which we are doing for the years. So.
Thank you for that. So that's a really important the challenge to industry there, but also highlighting the issue. We may have capacity development, but we need to remember the funding issue, particularly for the core funding activities. And I can see a question in the room.
Yes. Can you hear me?
Yes.
Thank you very much. I'm Miroslava Feveniš from Slovak Patient Umbrella Organization, and if I may have two questions. One is for Sukal. Could you please describe me what is the concrete procedure of involving layperson in the Part 2 assessment? Because I'm wondering whether there is another way of participating, because we in Slovakia, I am that layperson with a voting voice in the ethical committee. We have that ethical committee in at the ministry, not at Shukla. And what we are doing is that I am like a coordinator of patient participation, but sometimes it is not possible to include another patient with a concrete diagnosis to assess the informed consent. Then I have to do it, but I can't. I have patient experience from just one diagnosis for cancer area, but I can't do it actually for other disease areas. So I consult some things with specific patients, but at the same time I cannot provide exact information which are in the clinical trial proposer. So what is your concrete experience with the procedure? With participating laypersons. And my other question is regarding the education. How is Patient Hub cooperating with the APO regarding the educating and training of the patients? Is there any cooperation, or is it the two different ways how to train patients? Thank you.
I'm just going to let Robert translate that, because I recognize, Irina, you don't have a headset. So, Robert, do you want to repeat that question?
Well, thank you very much. That's an interesting question. We've been debating it here. Well, the microphones are not heard very well, so I'm not sure if I caught everything. Involvement of patients follows the European rules. So there is a regulation in place. The Ethical Commission is organized by the State Institute for Drug Control. The meetings take place at Sukal, and we've invited the scientific societies and patient organizations to nominate their representatives, so they've had to follow the rules in place. The minister signed the appointment decrees, and they then take part in meetings of that ethical commission. We wonder if that will stay the same, or whether the national legislation will change further. I'm not sure if I've answered your question, but we can discuss it informally later on. Thank you.
This is a huge debate about who you involve. Do you involve a lay member, a consumer, an individual patient, or a patient organisation? And I will share with you a paper where we spent about 10 years trying to define what these different roles mean. So this isn't just a challenge for Czechia or Slovakia or any other country. It is quite difficult, and I think the key is to clearly define at the outset who it is. So is it a lay member or a member, and what their role is? Are they representing all other diseases? And if so, how do they represent that? Or are they there as an individual with an experience, and they're then using that experience across all different disease areas. And so there are subtleties, and one of the key here is to have a very clear role description, to have a very clear selection process, and to recognize that to undertake such a role takes certain competencies. So it requires a selection process, it requires professional development when you're in that kind of representative role. So this isn't an easy question to answer from any country, and it's one we can continue to debate, and I can see that this conversation is going to continue, which is what this is all about. Robert, what's happening online?
Máme další otázky, které volně navazují.
There are further questions and that follow up on the discussion. So what are the further steps to be taken at present? Patients are involved in HTA in the field of rare diseases. The question is, what other diagnostic groups can you imagine to follow? Can you imagine that patient involvement will also involve medical devices or prevention even? So that's one question from the online chat. And then there is a second related question, and that is, do you see any barriers that prevent patient organizations in being involved in HTA? So is there anything that patient organizations need to catch up on in order to be able to get involved at all? Thank you. Thank you very much for the question. Let me start with the last question. So what shortcomings there are, what we need to be aware of. So we need to make sure that patient organizations are independent. I've touched upon this in my presentation. There has to be a systemic funding set up of patient organizations so that they have their core funding for their activities, so that they are not sponsored or funded by entities that would prevent them from being independent. At the same time, there has to be ongoing training or education so that they would be equal partners in communication and in the procedures. And I do apologize, I've forgotten the first question. Well, as for this first question, whether we plan to expand, at this stage we'll stick to just the orphans. We'll be evaluating how it works. There are not that many procedures in place, but going forward we can envisage involvement of further diagnosis, but perhaps not in the near future. Well, let me add to that. It's not up to me. I'm not representing a regulator here, but to go back to what was mentioned at the end, so what other areas could be viable in the future, whether medical devices or not. I believe it's great that we started with the orphans, because the important aspect there is that the data is lacking, so you can't do the calculations. There is high uncertainty. It's for a very small number of patients, etc. And patient organizations indeed do play a vital role there, because they can share their experience and can contribute to the assessment of public interest. And that can be expanded to further areas in the future. But first, yes, I do agree, we need to take a look at whether this path works, but then I don't think there are any barriers. Good morning, my name is Marie Ředinová. I'm from the Czech Republic, and I represent the voice of cancer patients. For 12 years, I was head of an organization helping stomia patients. I would like to specify one thing. Patients have been involved in medical devices already since 2017. In 2018, a great effort took place. A lot was done. We achieved tremendous legislative amendment. So that's one thing. And then there is this recent legislative amendment that came into force and effect on the 1st of January this year. Again, patients were hugely involved, and thanks to the involvement of patient organizations, we have achieved that change. So patients are involved in medical devices already from 2017. Let me also join in. We all agree that the statutory definition is key. I must say that even before the legislation came into force, and in fact we actually had given consideration to patient views, but now in the administrative proceedings, everything is enshrined in legislation, so it's more comfortable for everybody, easier to work with. I agree with the patient involvement in the medical devices, and allow me to make two further remarks. So we have the HTA regulation, which sooner or later will need to be transposed into Czech legislation, and there I believe will be room further discussion for further involvement of POs in these decision-making processes. And perhaps one last remark from my side. You asked about the barriers and what's necessary. So I must say that, for the time that I've been following these things and we've been cooperating with patient organizations, we have already gone a tremendously long way. So we've moved from the patient's true layman to present day. And I'm not flattering you, but you know many processes much better than the expert public, and you indeed do deserve to take pride in that. Thank you very much.
And importantly, bringing up the HTA regulation there. Maggie, I wonder if you just want to come in to talk about medical devices. So the processes you were talking about, do they relate to medical devices? And is it the high-risk medical devices that will be assessed? And will that happen in 2025 or will that come later?
Yeah, my understanding is that, yes, I know they do apply also to medical devices. There's also a medical device regulation, and so the involvement in terms of medical devices is going to come later because it's linked to the medical devices regulation, which, to my understanding, is a little bit running late, even though it came before the HTA regulation. But yes, this will include medical devices. I should say also that in UNETA we have done evaluations on medical devices, but we haven't we've included patients for the equivalent of an HTA report for medical devices, but in terms of an early dialogue or a joint scientific consultation, we have not done that yet. But it's also important to know that even what I've presented, even if what I've presented today for UNETA 21 is published and all wrapped up nicely, it doesn't mean 100% that's what's going to be done under the HTA regulation. So what we implement will be then given to what's called the coordination group within the HTA regulation, and then they will have to decide if they uptake what we do or if they make modifications or improvements or whatever to all of the documentation that we provide regarding our deliverables.
Thanks very much, Maggie, for that clarification. So you're part of UNETA 21, which is doing specific work for the Commission to inform them about how they can operationalize the HTA regulation, which comes into place for orphan medicinal products and advanced therapeutic medicinal products and oncology as the first kind of wave, and there will be some more news, and of course Sukul is involved in this at the highest level. I know we need to wrap up. I can see lunchtime approaching, so I'm going to ask the panelists one final question. Given all you've heard about, we sort of started by saying, you know, we can see that patient involvement is a journey. I'm going to turn to my two European colleagues first to ask you, what given your journeys, where you are in your organisation, what is the next thing you need to see, you need to do to support patients and patient organisations to become more effectively involved? And Maggie, we can see you on the screen, so I'm going to ask you that question first and then I'll turn to Maria.
Sure. So I completely agree that it's a journey, and it's a journey where we're not all walking side by side yet. We're at different points on the path, which is good that we're all on this path, but it'd be nice if we were a little bit closer together sometimes. I think that, well, we are making several recommendations for what should be done in the future, since we won't be the deciders in that. I think that in our case, some kind of a dedicated structure, not only for the identification of patients for their participation, but also to accompany them throughout their participation and improve our follow-up afterwards would be would be quite beneficial. So we envy Maria and her team at the EMA.
And Maggie, you could look to the Patient Rights Support Department here in the Czech Republic as well as another good example. But let's hear from Maria now. You've had long establishment, but are you still looking to improve?
Yes, thank you. Thank you for the question, Nicola. And sorry, Karen, sorry. And I think that it's really exactly as Maggie said. It is a journey, and in that diagram that I showed you, there's a lot of exchange in order to get to where we have arrived. It's by no means just the EMA on its own thinking about, what we need to do next. There's a lot of exchange with the patient organizations that has always led us to the next step. And patient organizations were very involved in even making sure that patient representation was on the committees, for example, with the orphans to start with. But for us looking ahead, we have some important strategies such as the regulatory science, the 2025. We also have the European Medicines Agency Network strategy, where we're looking now towards more patient experience data, patient-reported outcomes, etc., digital data as well. And so in that light, we also have a workshop that's taking place on the 21st of September. This will be recorded and then published, and then you'll be able to see that on our website. And also there'll be some publications emerging from that. So for us, we're always looking at different methodologies, looking at listening not only to patients and stakeholders, but industry, healthcare professionals, academics, and addressing all those needs. We do work very closely with HTA as well, and Maggie and I actually have a call planned next week. So we are always looking at working more with stakeholders, listening to the needs and trying to address those within the regulatory frameworks.
Thank you both, and thank you both for putting lots of links in the online chat. We will share them in a document with the people who are in the room. And just kind of 20 seconds each from my panel. I'm going to start maybe from that end. Katerina, can you tell us anything you've heard today that might make you think, oh, maybe we can reflect on that in the patient support department? Or do you want me to come back to you at the end?
This is a very tough question, but I want to thank all the POs and tell them that I really appreciate their work, which is important, significant, and we want to keep on supporting you, educate you, and assure also funding so that you can participate in all the processes where we try to find your place at the table. Thank you.
Tak já už jsem to v podstatě asi řekla.
I think I already said it a moment ago. So again, my compliments. Do not hesitate. If you want to solve something, this is addressing the patients. We are here for you, and you don't have to be afraid of us as a kind of regulator who doesn't want to talk to you. If you don't understand what we say, just ask. Thank you.
Door from SUKL to patient organisations. So, industry, what do you think?
Okay, so from perspective of industry, I believe that we need to mainly continue to cooperate. We need to continue to listen to your needs and to learn from you. I believe that we are doing many interesting activities and projects, and it's just necessary to go on because the industry is here to bring the medicines to patients. So we are here basically for you.
So I'm going to challenge you to go back to your industry association and decide one concrete thing and tell Robert what it is. So I'm going to give you that challenge to take away with you. But now, Jan, from the insurance perspective, your reflection on today, is there anything you think you could do to move forward the way in which you engage with patients or your consumers, your insured persons?
Děkuju za dotaz. Já si myslím...
Thank you very much for your question. I think the task is funding. That's for all of us very important. And for health insurers, all of you have thanked patient organizations for their work. Yes, we must learn mutually what we mean for each other. We have always needed the feedback from our clients. That's the only way. Otherwise, we cannot learn what's happening in real life unless we have audits or checkups. So all the insured persons are a huge help. Thank you.
Look at a patient experience, we can see how inefficient some health systems are, but maybe that's just the British system. Anna, we give the final word to you. What are your reflections on what you've heard this morning?
Thank you, Karen. First of all, may I just accept the praise on behalf of all us, the patient representatives. Thank you so much. But, you know, without you, we wouldn't be able to do what we are doing. And yes, we are a team. We need to work together, we need to learn together, we need to respect each other, and work on a good path to become good, eligible, respectable patient representatives that will help the process of achieving better quality of life for people in our countries. So let's continue in that. I think we have a good pace. I think we have a good team, and let's just continue on that path. Thank you.
I think that's great. That's a great point to go to lunch. We're all unified on the goal of improving patient outcomes. We can all agree that. I apologize for running over a little bit, but the lunch break will run until 1 p.m. here on Prague time. For those listening from Canada, you can go and get your morning coffee now. I know that there are some there from Canada and North America. So please be prompt back in the room and online at 1 o'clock. Those online, you can keep your session open or you can dial back in, whichever you prefer. So thank you, everybody. But we have to thank our wonderful panelists for that great discussion. Thank you so much.